Thank you, Mr. Chair, to the committee leadership and witnesses for calling this important hearing. The last time Dr. Fauci and Han were before us was March 3. I have a slide that I want to put up that shows what's happened in America since then. The chart, which is here, compares the experience of the United States and South Korea on 3 days. On January 21, both nations experienced their first case of COVID-19. At that time, the unemployment rates in both countries were essentially identical. On March 3, when the witnesses were last here, South Korea had experienced 28 COVID-19 deaths and the U.S. had experienced 9. Again, the economies of both nations, as measured by the unemployment rates, were nearly identical. But now the story changes. As of yesterday, more than 81,000 Americans have died, and the U.S. economy has experienced job losses not seen since the Great Depression. Meanwhile, the economy of South Korea has not changed dramatically at all, and the death toll is now at 256. South Korea is smaller than the United States, 1/6 of our population, but even if you bulk up the death toll to reflect the difference, the per capita death toll in the U.S. is more than 45 times the rate in South Korea. And the healthcare carnage here is causing a near depression while South Korea has protected its economy by managing correctly. I could have done this chart with other nations. The U.S. has the 7th highest per capita death rate in the world. Our death rate is off the charts higher than that in India, Australia, New Zealand, Japan, and Mexico. It's nearly 3 times the death rate in Germany, twice as high as Canada's rate. The question is why? If we want to open up our economy and schools, we have to learn the lessons of nations that have managed this well. Here are some things that don't explain the difference. Our hospitals are as good or better than those in South Korea. Our healthcare providers, heroes, are as good or better than those in South Korea. Our research capacity is as good or better than that in South Korea. And we have more resources than South Korea. Our GDP is 12 times South Korea's, and our per capita income is 50% higher. So to Dr. Fauci, the death roll in the United States, the death rate in the United States, especially when compared with other nations, is unacceptable, isn't it?
Excuse me, sorry, sir. Yes, of course. I mean, a death rate at that high is something that, in any manner or form, in my mind, is unacceptable.
And Dr. Fauci, the experience of other nations shows that the U.S. death rate is not only unacceptable, but it's unnecessary. Isn't that correct?
I don't know if we can say that, Senator.
But would you say that the U.S. has to do better?
Of course, you always have to do better. I mean, as a
And the experience of South Korea shows that how a nation manages the healthcare crisis has a huge impact also on its economic condition. Isn't that the case?
That is the case, sir. I understand where you're going with this, but I have to tell you there is a big difference between South Korea and the United States and the nature of the outbreak.
And let me get to that. I want to get to factors that do explain the difference, since we know it's not resources or our health providers. First is testing. South Korea began aggressive testing much earlier than the U.S. Now in the 5th month of the pandemic, we surpassed South Korea in per capita testing, but in the critical month of March, South Korea was testing its population at a rate of 40 times the testing in the U.S. Admiral Gerard, Dr. Gerard has set out the standard for us. When we get to September, he says the United States needs to do 40 to 50 million tests a month to be safe. That equates to about 1.3 million to 1.7 million tests a day. Yesterday, we did 395,000 tests. We've got a long way to go. A second factor is contact tracing. South Korea embraced a rigorous contact tracing program right from the beginning. The United States still has not engaged in a national contact tracing program. Isn't that right? Would that be Dr. Fauci or Dr. Redfield?
Sir, I think that question would best be directed to the CDC and not the NIAID.
When the outbreak started, sir, we had an aggressive contact tracing program, but unfortunately, as the cases rose, it went beyond the capacity, and we went to mitigation. So we lost the containment edge. Clearly,
that was key to the economy as well, because South Korea did testing, contact tracing protect, serve, isolate the sick, and then they didn't have to do the shutdowns, which helped their economy. Social distancing is the third factor. We've talked about it, but finally the last one, healthcare systems. Would you agree with me that it helps keep people safer either from serious conditions or death from COVID-19 if they have access to healthcare?
Yeah, yes, of course.
Of course that's the case. In South Korea, 97% of the population have health insurance. In the United States before COVID-19, millions didn't have it and lacked access to health care. The massive job losses in the last months threatened to take health insurance away from millions more. And President Trump is doing all he can to dismantle the Affordable Care Act, which would take health insurance away from tens of millions more. Let's learn the lessons from those who are doing this right. Thank you, Mr. Chair. I yield back.
Can I make a clarification, please, Mr. Chairman? This is Brett Giroir. I just wanted to clarify that I did project that we will have the ability to perform 40 to 50 million tests per month in that time frame. But I said if needed at that time. I am not making a proclamation. We have to really understand where the epidemic is, what the community spread is before we can estimate the number of tests that are needed. I was simply stating the fact that our combination of testing capabilities will be at that level, even barring new input from the NIH.
Thank you very much, Senator Kaine.